It's supposed to record. I just remembered. Okay, there we go.
Yeah,
Sorry.
that's fine. Yeah, you can record. So yeah, so it's yeah, so I was telling the others that you're here, and I think because you're here, we're gonna have to like hopefully there's lots of other people that would love to meet you.
Oh,
like
yeah. You know, there's so much
yeah,
dogma around the dominant view that sometimes people won't even consider listening to alternative voices. And so I'm glad to hear that there's a group and open to that.
There's a lot of information a lot of people don't know. For example, the first FGM conference documentary that was done in the UK, I think I took part in that documentary. I think it was 1990. Maybe I was 20 or 19 years old, and wow. I shared my story. But on that documentary, Brian, a lot of people don't know this, it was a 40 minutes documentary by Louise Panton. And they actually went, you know, the anti-FGM campaigners, they actually went to Sudan, or was it Sudan and Chad, and they videotaped girls being circumcised. The person that sanctioned that was the mother of the campaign, was Efra Donker, who passed away, and Louise Panton. And I kept saying to them, this is wrong. And I was kind of young at that time, because I was kind of naive, and I was like against it, and I was talking about it. But then I think the strategies that they use was wrong. So you're saying you want to protect children and stop FGM, but then what you're doing is you actually go in there with a film crew and watch filming for the British audience. And they
I've read about this, and it's so voyeuristic and disrespectful and kind of shock British consciousness.
What about her rights to her body? Like,
yeah, exactly.
You don't care about it.
She gets turned into just a bodily example to be paraded around, which is a further violation of her privacy. I can't say the details about this, but I got a call from a colleague, probably somebody you know, who was called in to do an exam on a girl, I think from the Somali community in Switzerland. But there was she'd gone on in for a forensic exam because she'd been sexually assaulted. And then because of her, background, there was this assumption that maybe there was some further problem in this, that my colleague had to be called in and do an exam. And so the issue here is that, had she found evidence of something, she has a mandatory reporting requirement. And then this young girl who's come in to get help for having just gone through a trauma, now would potentially be in a position where her parents would suddenly become criminal suspects on the basis of coming in for something totally unrelated. And so my colleague called me and said, I don't know if I have to practice civil disobedience here, because I'm a doctor and my job is to care for the well-being and the interests of my patient. And, she's coming in because of one thing. And now there's this, assumption that there might be some other problem. And I don't think it's appropriate to be bringing that in, that question into this particular exam. And so, I think we might need to write that case up as just a further evidence, like Sarah's been showing, of the side effects of these criminalizations and the zero tolerance, all that stuff, and the selective application of these laws. It's really unjust, and these are the kind of real world consequences that happen on a practical level when you decide to selectively criminalize some groups.
So I talk about how families are persecuted by the FGM laws, and communities are marginalized, and I give examples about the FGM orders and the safeguards and how it's discriminatory.
These laws that are very high-minded and people think they're saving little girls or whatever, but actually they're harming those very same little girls, and they're getting these exams and so forth. So what do you feel like are your main priorities right now as you're looking at the status quo?
The priority, what I think is really important, is we need a national conference on the medical aspects of female circumcision. The way you describe on your video and your articles, a lot of them don't understand it, like the anatomy of the female organ and the clitoris, and they say, oh, the clitoris being cut, and we need somebody with your expertise to actually explain that to them. Because I send a lot of your articles and your videos to people, and they don't know, and I goes, oh, you really need to watch his videos. And then everybody like, oh my God, thank you for sharing this. We've learned so much. You're basically educating them, because they're so misleading. And that's why I was saying a conference is needed with regard to the medical aspects of female circumcision. And what are the difference between the two? Because a lot of people think that the female circumcision type one is like more invasive the male circumcision. If anything, the male circumcision is actually more an invasive procedure. With
Yeah,
the
I mean,
one,
so I think people often assume that the foreskin is just sort of a useless bit of tissue. They don't understand how sensitive it is. So they compare in their minds what they think is the total disabling of women's sexuality with what they construct in their minds as a trivial little bit of skin in the male case. And they go, well, obviously those are completely different. And you're right, it's just anatomically they're mistaken, medically they're mistaken. And I even object to the pricking type procedures, partly because what I think is people simply have a right to set certain boundaries around their sexual embodiment. And so you don't actually have to go tally up exactly how many benefits and how many harms and what exactly is the risk of doing it this way versus that way. Because ultimately, it's about being able to set a boundary. If you grow up in a society that tells you that you should have dominion over your sex parts and no one should be involved with that part of your body without your consent, and then you find out that when you're a kid, someone already crossed that boundary, then that's enough. You don't need to ask how harmful it is. You just say they didn't have a right to do that. So that's
no,
what
they
I'm trying to
do.
say these
They
days.
do. Yeah, and I think even for us, like who's gone through female circumcision, it was always like we didn't consent to this. Yeah.
Yeah.
And
Exactly.
I think when we found out about it, it was like, Brian, what did we say to our mum and our aunties and grandmas? It's like, we did not consent. You did this for nothing. Yeah, you did something, and and a lot of the girls do remember it because it was very traumatizing. Just not the pain that somebody, the most private part of their body, being exposed to and holding a girl down. That's when people stay. Yeah, and they don't. A complete boundary has been broken.
I've just submitted an article with some colleagues about even just medical exams that are unnecessary, where they do these. Well, first of all, you have the exams that get inspired by these cases where they're collecting evidence, which can be extremely traumatizing to these young girls. But also, sometimes doctors will do these routine puberty checkups for no reason. There's no symptoms. There's no problem that's arisen, but they think, well, we should just be, checking this part of the body. And it's like, just because you're in a doctor's office doesn't make it suddenly open season on your body. It's still a private part of your body that you should only be, letting people have access to as necessary. So yeah, I agree with you. It's not, from the moment that you're in a vulnerable position and you feel like your agency is taken away and you're exposed, that's the harm has already been done. That's before you even get to the cutting.
Before it even gets to the cutting, yeah. And that's the bit that people, I think, fail to understand. And I think with the Bahara community, yeah. The Bahara, they say, they just did the bricking. But then what I talk about is, I say it's actually crossing they shouldn't even open the girl's legs and had her on a couch. It's wrong. And that's what I tend to say, because you got to put yourself in that situation as a non-consenting child. You got adults, putting you, doing this to you. And I think even for all these girls that are examined at the UCL clinic and being accused of FGM, they're doing it. So what I say to my clients, like I had one lady, she had a 12-year-old and 13-year-old, and they were accusing them they might have done FGM and they wanted to examine them. So I said to the mother, and I sat down with the girls, and I said, nobody can actually force you to be examined. So the social workers are not putting pressure on the mother. So I explained to them their rights to their body. And I said, and the girls said, no, we will not be examined. So they tried to use emotional coercing. Oh, it's fine, it's that, but the girl is not comfortable. So it's another form of emotional abuse, I think, because and they're not happy. So those two girls, they refused. They said no. They were adamant, because I taught them what their rights is to their body. I go, they can't force you.
That's really, that's what I said to my colleague who called about the girl who had the sexual assault. I said, a doctor can't perform an exam that's not consented to. And so if the girl says, no, I don't consent to this exam, and if the parent doesn't give proxy consent, then it can't proceed. It's an assault. Even if you're a doctor, you don't have a right to someone's body unless they consent. So yeah, I think that's a very important point. That even these exams are crossing the line unless they're wanted by the person and they think it's going to help them, and they've made that decision. But the sense of entitlement, that's the thing that really bothers me. It's the sense of entitlement to other people's bodies.
Absolutely, yeah. And I think even though I think with me it's okay, we're Muslims and Islamically the boys are supposed to be circumcised.
Mhm.
It's in the you know is in Islam. Muslims and
Mhm.
Jews, they circumcise obviously, but I think the story of, I think Abraham's son, I think he was 14, he was a lad. Yeah. So it's
Yeah,
described in the Old Testament that he was a lad, and a lad would be like a teenager.
yeah,
So maybe he was able to consent. So for me, it's like I've always said, Brian, like I used to say to my husband that time when I was married to him, it's like, okay, we had 3 girls. I'm not if I had a boy, yeah,
yeah,
I know everybody would put that pressure of you circumcised, and I would say, well, I won't feel comfortable, you know,
yeah,
and I just like I would rather him consent to something. Even like I never pierced my daughter's ears. I was like,
yeah,
unless they spoke and said, pierce my ears.
yeah.
And you know, so I've always thought about that because of my own experience. And I think a lot of people don't look at this about, you know, the boundary between the body, you know, about the you know, this is like you've got to have clear boundaries, and you're going to have that those boundaries as a parent with your children as well when it comes to their body. And people don't understand that. Everybody thinks they have a sense of entitlement. And that's
Absolutely. And you know, when people are talking about, um, you know, a kind of culture of sexual assault, and you say we need to teach boys to respect girls' boundaries and women's boundaries, and it's like, of course, that's true. But the message that boys get in circumcising cultures is that they don't have boundaries. And so then we go and turn
mm,
around and say you should respect other people's genitals, don't touch anybody without their consent. And then some of these boys grow up and they go, well, I was not just touched without my consent, you know, part of me was removed without my consent. And then it
mm.
feels like, you know, what really is our underlying principle here? And I agree with you. It should be a person's choice, you know. Yeah, and I don't see why a 13-year-old or 14-year-old couldn't consent to something that they've
Yeah,
contemplated and it's very meaningful to them. You know, Rick Schwader has made this point. He says in Kenya, where you have maybe like an adolescent rite of passage, he says the Kenyans say, well, we understand the meaning of the ritual. It's this bonding experience. We learn about our whole history and all the beliefs of our culture. He says, but in the United States or in Judaism, where you do it to a baby who doesn't even understand what's happening, it has no significance to them other than just the pain. And then they have to learn about it after the fact and then decide how they feel about that. It's very interesting. He has a certain kind of respect for Kenyan culture because they wait until they're at least in adolescence and they're
yeah.
making a decision to prove their, you know, adulthood by
Mm.
making a choice. So
Yeah, we do not consent.
yeah, yeah,
Yeah, and that's the message. Like children don't consent. It's
yeah,
adults consenting for them. But I know like we all agree on some aspects and disagree on the other. But the
yeah,
main thing is like we should definitely work towards the things that we agree on. We know like the anti FGM campaigns are very damaging to communities. WHO and what they do is just, you know,
yeah,
especially the terminology FGM. It's
yeah.
you know, it was replaced by the female circumcision, and I was there when that terminology was replaced, and then it was endorsed by EFWA in because she went to go work for WHO. So it was at the Brighton conference, feminist conference.
When was that? What year was that? Do you remember?
I think it was 1990 or 1989.
Mhm.
Like so Afra was the director of Forward, and they so I think I spoke at that conference, and that's when there was a feminist lady. The office was in Covent Gardens, and there was me and another girl, and they were talking about the terminology female circumcision was not the right terminology, and this lady used to say, you're mutilated, and me and the other girl would say, like, no, we're not mutilated, yeah.
Yeah,
And so it's other people's defining what we are, you know,
yeah,
and people
absolutely. It's
um,
another form of violence. That's the thing that's
yeah,
so
it's another
crazy.
form. And Dr. Harry Gordon, I don't know if you heard of Dr. Harry
No.
Gordon. He's retired now, but Dr. Harry Gordon is the first gynecologist doctor that actually did the de-inflammation on,
Oh,
yeah. And
yeah,
he never used that word.
yeah,
He did my operation and several other people, but he would never use that word on.
yeah,
He would never use that word mutilated, but we get other people telling us that, and that again, that word needs to there needs to be a big discussion about this word FGM and mutilation.
I
And
completely
honestly,
agree.
Brian, you're the only one that can really educate them and from by and you know, Brigitte,
Yeah,
there's
Sarah and I wrote an article where we had a whole thing about terminology, and I completely agree on this. You know, if somebody considers themselves mutilated, that's fine, but that's their choice. It should never be forced on someone. You know, it's literally adding an insult to injury. It's saying, you know, you've had something happen to you, you're grappling with it in your own way, and you're figuring out how to come to terms with your body and your relationship to your sexuality and all this. And then if somebody comes in from outside the culture and just says, we declare that your status is, you know, a mutilated person, it's like I can't conceive of anything being more disrespectful than that. And yet that's the World Health Organization's language. So yeah, I constantly am just going after the WHO. I even talked to the woman who is leading the WHO policy on FGM right now at this international experts meeting. And I said, you know, if we're talking about giving agency to, you know, respecting people's agency, we should be very clear that forcing labels on them is to deny them that agency. And we shouldn't be saying FGM. And she said, oh, well, you know, when we actually talk to the women, we use some other word, you know.
this is what they always use.
Yeah, and she said, you know, in our policy documents we say it this way, but when we talk to the communities we say another way. And I said, that's really condescending. You know, you think, oh, in our policy documents we're going to just define things a certain way, and then we'll go, you know. I said, just you know, use the respectful language everywhere. Don't you know, use one set of words for one group and another set of words for another group. So I was really dissatisfied with her response.
Right. Okay. Yeah, and that's what it is. It's very so yeah, so it's very, and this is what's been happening for decades. It's like all these ladies are being called that they're mutilated, or they cannot lead happy sexual lives, and you know, and they're sexually dysfunctional. These are all the myths that we need to really pull out on the conference. So I think if we do a conference, and you do a conference, it's more geared. We can talk about the history and the campaign, but really more go about the medical aspects of what is female circumcision, male circumcision, understanding the differences, because they constantly say that the anti-FGM, like they're saying, oh, this is worse, you know, and then also the terminology. Where did the word FGM come from? And we were there when that terminology was created, and they just replaced it by females. They just replaced it. They wanted more for the campaign, and she said,
who was it that proposed to replace? Was it Fran Hoskin who was pushing that initially, or who
I
was?
think Fran Hoskin, yeah, Fran Hoskin. It was in the Covent Garden office in Forward, and we kept telling her, no, oh, you're mutilated, Africans are barbaric. And she used to use the word African, and we were only young. Don't forget, they're 10 years or 10 or 15 years older than us at that time. We looked up to them, innit? And they were like our mentors. And then we're like, and me and the other girl said, no, we're not mutilated. And at that time, Brian, for me and the other girl, we still were infibulated. But we haven't had that operation at that time. So basically we were just finding ourselves. It was kind of therapy for us as well, like understanding what actually happened to us children and understand it medically. So basically but we knew that we were mutilated, because when you look at mutilation, you're cut up into pieces. And then we're like, no, and I goes, don't say that, that's not the case. And they goes, no, the female genital mutilation. And that's how she created the word. And then it was endorsed at the Brighton conference, the feminist conference. And Alfred Don Carew, who went to go and work for the WHO then, carried that, make sure that word got endorsed by the WHO. So that's how the word was created. And people say, oh, it's not the same. So with the anti-FGM or FGM and female circumcision is not the same. They are absolutely, this is a terminology that was just replaced to get more funding, to, you know, to get more known, really. So they had to use a word that was so offensive.
Well, and they also explicitly wanted to distinguish it from male circumcision because they knew that that was an accepted practice in Western societies. So they said, you know, if people think of these as the same, then they won't agree with us because they accept one of them. So we have to explain how ours is this totally categorically different thing. And that's how this discourse was started, where it's like, you know, totally separate rules for boys and for girls. And it stopped being about consent, which is interesting because the WHO definition of FGM doesn't even talk about consent. It just says any medically unnecessary cutting. So, okay, that should include labiaplasty and all these cosmetic surgeries, but it obviously doesn't.
Labiaplasty is is the female circumcision that we had type, okay, we had type 3. So we had type 1, 2, and 3 together, like when we look at the Somalis and what we had. So and then so type 2 was they cut the labia minora majora, and then they sew it together, right?
Yeah.
And that was the one that most of my girls in our community had back in the 70s, 60s, yeah. So, but when we look at it, they cut the labia minora majora. It's labia. That's what they do, labiaplasty. That's
Yeah,
exactly.
exactly.
But all
And
they're
so,
not doing is not closing it, but they're cutting it.
yeah, yeah, and you know, implicitly they understand that if that's consented to, it's different because they allow, you know, women to go ask for this procedure. But then in their definition of what they consider mutilation, they don't say anything about consent. And so the fact that they're not campaigning against labiaplasty again just shows that it's a double standard.
It's a double standard, yeah, hypocrisy. And then it's a hypocrisy with the boys, because male circumcision, boys are allowed to have these operations.
Yeah.
Which you've explained beautifully, and the girls are not. Yeah.
Yeah.
So a female is more valuable than a boy's genitals.
And then in all these kind of debates about the symbolism, what's lost is that, you know, when you're 3 years old, there's no way you're making a decision about your own body. And maybe you don't agree with the symbolic meaning that being foisted upon you. So, you know, you have a really fascinating story. As you say, you're there from the beginning. And it was the Fran Hoskins of the world who ended up, you know, getting the limelight. But you've been being consistent for, you know, dozens of years now, and I think your story needs to be told in terms of your involvement in these issues.